Hey, it's Dr. Rucker. I have some questions from the viewing audience. I'd like to give you a little question and answer regarding GLP-1 agonists. That would be the class of products that are involved in weight loss, tirzepatide, semaglutide. So the first question is the topic of titrating dose, how to safely adjust GLP-1 dosing as the body adapts. So essentially the starting level dose, depending on each patient, ends up being 10 units, 15, or 20 units on an insulin syringe. An insulin syringe usually goes up to 100 units. My typical average titration upwards is 10 units per week. I think you could ask me this question 90 times. There's no right answer for each person. It's going to vary according to the size of the patient, how much weight they want to lose. But you could safely keep going up 10 units every week until you hit your sweet spot. And at that time, your body will have adapted. Generally, I don't have patients use more than 50 or 60 units as a dose because to me, if you don't, you're kind of doing something wrong. This is a great lead into the concept of best practices for tapering once you've reached your weight loss goal. There's no perfect one size fits all correct answer. Let's say you're on a 50 unit dose. You might find your stable dose that you just want to keep things at bay. A good rule of thumb is probably a third of your dose. So if I had a 50 unit dose patient, I'd probably say, why don't you try 15 units every week? You just have to find your titrational support level.